Nearly all Americans believe healthcare just costs too much. And in 2021, 1/3 skipped getting medical care for a health problem altogether because they couldn't afford it. But one program in particular serves as a safety net for over 80 million people across the U.S.
Illinois, now the first state to offer Medicaid access to low-income seniors, regardless of immigration status.
Good news for expectant moms in Michigan this Mother's Day. A new provision allows extended Medicaid coverage for women after their babies are born.
Missouri is now the 38th state in the nation to expand Medicaid.
So, what is Medicaid? It's been almost 6 decades since Medicaid was first introduced. President Lyndon B. Johnson signed the Medicare and Medicaid Act, better known as the Social Security Amendments of 1965, as part of his war on poverty.
Millions do not now have protection or security against the economic effects of sickness, and the time has now arrived for action.
Both Medicare and Medicaid are now the pillars of our modern public health system. Medicare is a federally funded health insurance program for people 65 and older. However, a younger person with long-term disabilities or on dialysis may also be eligible. It is not based on income. Medicaid, on the other hand, is a needs-based federal and state program that provides medical and hospital coverage for those struggling to make ends meet. Today, there are 7 million people in the U.S. who are uninsured and eligible for Medicaid. 40% of them are Latinos. They include children and pregnant women from families living below the poverty line, low-income seniors, including those who need nursing home care not covered by Medicare, people 64 and under with disabilities, and lastly, some adults with limited incomes. All 50 states and U.S. territories, as well as Washington, D.C., run their own Medicaid programs. However, most Medicaid providers are privately employed. States receive federal funding, but they set the rules, which means eligibility requirements and benefits in one state might look different from those in other states. For example, New York Medicaid covers extensive dental services, including cleanings and oral surgeries. Meanwhile, in Arizona, Medicaid only pays for emergency dental work. However, the federal government does require certain benefits to be covered no matter where you reside. Inpatient and outpatient hospital care, labs and x-rays, physician care, and home assistance for older patients. Children also have their own set of services focused on preventive care and well-being. As the cost of living continues to rise, hardworking families are sometimes left with the tough decision to either put food on the table or pay for health care. That's where Medicaid can step in. Take Mauricio and Mariana Osuna, who live in Virginia with their 2-year-old daughter Estela, and another soon on the way. Several months ago, Mariana was laid off and now fills in at a local restaurant. In the meantime, the family is primarily relying on Mauricio's income to pay their bills. The hours at his landscaping job vary, and he isn't eligible for benefits. But because Mariana is pregnant and from a low-income household, she can sign up for Medicaid regardless of where she lives. It will cover her regular doctor's visits to keep her healthy, as well as the baby's hospital delivery. Meanwhile, Mauricio and Estela are also eligible under state law. Without Medicaid, the Osunas would most likely not be able to afford health care. At the end of the day, Medicaid is a public service, just like the public schools kids go to every day. Traditional public schools are the backbone of our country's education system, and Medicaid is the backbone to our healthcare system.
Tell me what you need, what you really need. Medicaid! Tell me what you want, what you really need.
Without it, millions of struggling people, particularly 1/3 of the Latinos in the country, wouldn't have access to medical care.